Let's start.
But with COVID, that was also another transitional period in my life too, because I only was really at the job for like at most a year and a half or 2 years. And then when COVID hit, it hit us hard. Like I've never seen so many patients come in and out that hospital when we had the mask implementation. Like everyone was wearing masks. We had coworkers who would battle, didn't want to wear a mask or not. Some of them lost their family members, their friends, mainly a lot of older people too. And then the drove of specimens that we would get in blood gas and coagulation to see whether or not people, because like when you had the COVID infection, you were more likely to also develop a stroke too. So we would see a lot more patients in, like they would be thousands. But when you work in a big hospital, you already get thousands already, but it's double, tripling that.
What do you think? What do you think provoked the strokes when people that had COVID?
Say when you couldn't breathe properly too, pretty much you're accessing your blood pressure up higher and higher to the point where it makes it much more difficult to breathe. It's more likely for you to develop a stroke later on. And for blood to not properly flow and to build up cells within certain arteries and veins too, you're going to more likely develop a stroke. And that was
a common symptom then.
Yeah. So pretty much COVID was another prefactor for that too. And also you would see a lot of your white blood cells increase massively because you're fighting a viral infection that is unknown that it can't really deal with. And imagine it being able to bypass that too.
So that your body immune system is producing the right mechanism, but it doesn't know how to attack the invader. It doesn't recognize it.
Well, yeah, that's with any infection too. But with this one, it was very tricky, especially because like viruses aren't natural, but COVID was a very particular case too. Like it was
made it particular? What made COVID so particular? Was it a unique virus? Do you think it was genetically done, or was it natural?
Well, we don't. And that's the thing. There's so many theories of how it might have been lab grown, how it came from maybe bats or something, and it just spread like that. It was like there's so many theories that we can't really nail down with, without also causing a lot of strife within the medical community as well too. But I'll tell you one thing about it: COVID was very unexpected, and it was a slow buildup. It was a slow buildup that we kind of saw happen, but we didn't really tackle it like the way we should have until it got so big where. When it affected a whole continent, a whole country, that's when it was like, okay, now this is a big threat. Now the whole world is on alert for this. That's when it became serious. And like, that's when it started affecting our life. I remember someday, since I work in New York, like New York is always bustling and moving. So I will remember days when I would get dropped off, when I would get off the bus sometime or the train, Times Square, Port Authority would look like a ghost town. There'd be barely anyone there. I remember during that trip, I remember certain shops and stores. I remember there was like a pizza place that was by the Port Authority. I remember Mexican restaurants and all that stuff. Certain stores, they shut down because of COVID. Majority, unless you were essential, they were shut down. They could not make business. And even after COVID ended, most of them never came back. They were gone. Now, COVID didn't just mess people physically. It messed with society, like economically, psychologically. Like it changed our whole lives.
How you dealt with the work overload of COVID? And I see that your work is almost like the operational manager for doctors. So how was the communication during that time as well with your doctors?
It was very difficult. Because like sometimes you would have to we would also call doctors for criticals, redraws. Let's say if a specimen wasn't right, and they're already stressed out, so pretty much we would deal with not just reluctant doctors, but angry doctors and nurses, because like they were just as much stressed out. And I can only imagine how they feel. We're in a lab. We just mainly see each other and specimen. Imagine them and nurses seeing bodies getting put into trucks. So many friends, family, senior citizens dying, especially by themselves, because they can't interact with patients because like the risk of spreading the virus was so lethal. It was that bad. So that took a psychological toll on so many people. So like I feel for them. Like the communication was hard, but like it was understandable. Like we just had to get what we had to do. But we relayed important information that they needed in order to progress and what they needed to do. It was a very, very tough transition.
How did you dealt with your mental health during these times? What are the coping mechanisms you put yourself into?
I had to talk with certain friends. I had to keep myself busy. I had to I tried different activities too to try to get to do that too. And that was also the two things that happened when COVID really hit. That's also when I switched from evening shift to night shift. And that's around the same time when I went back to school for my master's. So going to school for my master's, also during this period, was a great distraction because I could focus on this and work and nothing else.
Yeah, I believe you make the right choice because anxiety hates a busy mind, and you kept yourself always, your mind capturing new data, new information, new experiences. You didn't let it evolve into any sort of anxiety disorder or emotional disorder. This is so fascinating because COVID reminded me of war.
Yeah.
The chaos of war, myself being a war veteran. You saw kind of the same paradox, but in a different setting in the hospital system, especially when it collapsed so quickly. Let me ask you this. What have this experience taught you? Because we should not take for granted not only your level of education, how smart and brilliant you are, but also now you have this also as a personal title under your belt of dealing with a pandemic of this magnitude. What have that taught you, and how is this experience so fundamental if, let's say, a new pandemic hits the world?
Oh, this is a great question. Okay. So there's like 5 instances where it's like the COVID pandemic really changed me. One, it changed me physically because when I first started the job and also during that transition of the pandemic, like originally I was like very skinny, but like when you're in a stressful environment and you're constantly worrying about going in and out, when you don't have time to prepare, I would just snack a lot. I would just eat. I would stress eat a lot to the point was like I got big, but it wasn't a healthy big. And this was also the period where it was like, okay, my sugar level was a little bit high. My cholesterol level wasn't really good. So like it made me see like how when you're in a stressful environment like that during that transitional period, it will take a toll on your health and you won't even realize it until it starts affecting you. And that's when I started working out more and started being more physically active. But then also there was a case where I had a hemorrhoid. I ended up developing hemorrhoids because of my poor diet and lack of exercise. So it was like now I had to develop not only a better lifestyle where being more physically active, but being more mindful of when I eat. That was one aspect. The psychological toll, like it made me realize how much life changed. And when you see all your loved ones impacted by this too, and how it pretty much, it separates you to the point where like you can't even interact. And people didn't realize that not being able to see your loved ones for a certain period of time and whether or not you didn't know if you were ever going to see them again, it takes a psychological toll. And it took one on me too, because I didn't know if I was going to see my friends. I didn't know when I was going to be able to meet new people. I was just stuck in a small section of the world. And I had to maintain that for 2 to 3 years in order to survive that. Then I realized also for me, but this was also a personal anecdote, but it's also a good one.
Welcome back again, Ethics Skill Podcast, where we explore human experiences. And if you haven't subscribed yet, do not forget our campaign. We are committed to transform your subscriptions into pro bono programs for mental health. So you can free somebody's mind from their traumas and help them heal just by subscribing. Very simple, and it costs absolutely nothing. Help us through this campaign, and we just want to pay forward, not only to our viewers, but for those that can't afford mental health services. Just remember, the statistics are real. Only 4 out of 10 Americans can afford mental health services. So help us change that. Hopefully, we can move the statistics and perhaps move it from 4 to 5 out of 10 people have good mental health services.
Let's start.
To the success of the Unity Brunch, may we continue moving forward together. Cheers!